Welcome to the deep dive. Today we're looking into something pretty fascinating and frankly quite critical. It's a potential link between something you see everywhere, like a golf course, and a serious health issue, Parkinson's disease. We're digging into an analysis by Professor Lin from their website, professorlin.com/scientific healthcare. The site aims to, and I quote, avoid rumors, prevent misguidance. So our mission here is really to trace this potential connection, how we go from early ideas to the actual science and why thinking critically about this stuff matters, explained clearly for everyone.
Absolutely. And what's really interesting, I think, is how science can take these, well, almost anecdotal observations sometimes and turn them into something solid. It reveals these subtle, maybe hidden links between, our environment and our health. Let's get into how they investigated this one.
Okay, yeah, let's do that. But first, maybe just a quick refresher. For anyone who isn't super familiar, what exactly is Parkinson's disease and what do we generally know about what causes it?
Sure. So Parkinson's is what we call a neurodegenerative disease. Basically, it affects the brain over time. And we understand it's usually a mix of things your genes playing a part, but also environmental factors. And on the environmental side, exposure to certain pesticides is a big one, a known concern. Yeah, for instance, pesticides like paraquat, that's DHA, and rotenone. Studies have shown they can actually cause Parkinson's-like damage in a specific brain area, the substantia nigra. It happens through things like oxidative stress, problems with mitochondria. But basically, the cells making dopamine start to die off. This isn't brand new either. We've seen studies like back in 2020 on rotenone, and even more recently, 2024 on paraquat, pointing this out.
Right, and connecting that knowledge to something like a golf course. That's where it gets really interesting, doesn't it?
Exactly.
So how do golf courses actually fit into this picture?
Well, think about it. Golf courses use a lot of different chemicals, pesticides mainly, to keep those greens looking perfect. And some of these chemicals, things like organophosphates, chlorpyrifos, MCPP, 2,4-D, MANEB, even some organochlorines have been flagged as potentially linked to Parkinson's.
And this idea, this connection, it's been around for a little while, hasn't it? It's not totally out of the blue.
No, not entirely. You're right. Back in 2013, there were actually two doctors, Margaret Parrish and Robert Gardner, from North Carolina's Department of Health. They published something, just a letter to the editor, in a journal called Annals of Neurology. It was based on their observations. They looked at 26 Parkinson's patients and found, quite strikingly, that 19 of them lived within 2 miles of a golf course. So they asked the question right there in the letter, is living downwind of a golf course a risk factor for Parkinsonism?
Wow. Okay, so that's an early flag. And it immediately makes you think, well, how could these pesticides travel? Is it blowing in the wind?
Or, yeah, seeping into the groundwater, maybe?
Yeah.
Getting into the drinking water supply?
Right. But like you said, it was an observation, anecdotal, compelling, sure, but it needed more rigorous science behind it.
Exactly. You need controlled studies to really know.
Yeah.
And that's where this more recent research comes in. A big step up.
Okay, tell us about that, the 2024 study.
Right. So this study was led by Assistant Professor Brittany Krutzenowski over at the Barrow Neurological Institute in Arizona. They looked specifically at two things: how close people lived to golf courses, and whether their home was in a water supply area that included a golf course. Much more specific. They used a really solid data set too, the Rochester Epidemiology Project, looking at data from 1991 all the way to 2015. And they published this in JAMA, the Journal of the American Medical Association. So, high-profile, peer-reviewed. This gives us a much stronger evidence base.
Okay, so this is where we get the hard numbers. What did they actually find? What does this mean if you live near a golf course?
Well, the results were pretty stark, actually. They found that people living within 1 mile of a golf course had a 126% higher chance of developing Parkinson's compared to people living more than 6 miles away.
Wow, 126%. That's more than double the risk.
It is, and there's more. If you lived in a water supply area that also had a golf course in it, your risk was nearly double compared to living in an area where the water supply didn't have a golf course.
Okay, so proximity and water source are both key factors.
They seem to be. They also found that for people just in those golf course water supply areas, the risk was 49% higher compared to folks with private wells.
Interesting detail.
And maybe one of the most telling findings: if you were in an area with both golf courses and groundwater that's known to be easily contaminated, the risk of Parkinson's jumped by 82% compared to areas where the groundwater was considered less vulnerable.
That really seems to tie the pesticide use, potential water contamination, and the increased risk together quite clearly.
It does. I mean, if you connect this back, this large controlled study really provides strong support for those earlier observations. It shows a very real, measurable link between living near golf courses, the potential for pesticide exposure, especially through water, and a higher risk of Parkinson's. It moves it, like you said, from anecdote to actual data.
So, bring this all together, this deep dive, drawing on Professor Lin's analysis, it really shows that this isn't just some rumor floating around. The link between living near golf courses and Parkinson's seems to be increasingly backed by solid scientific evidence, especially around pesticides and water.
Which, underscores that whole point about critical thinking and relying on data, like Professor Lin advocates, avoiding the misinformation.
Absolutely.
So maybe a final thought for you listening. How does this kind of research, this environmental detective work, change how we should think about health risks in our own communities? And maybe what important questions should we be asking about, say, public health policies or environmental rules when we see findings like these?